This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am VC Pramod and with me is Vaibhav Srivastav. The headlines. Prime Minister Narendra Modi gives call to light diyas, candles at 9 p.m. tonight, symbolizing nation's collective spirit to defeat COVID-19. Citizens reminded to maintain social distancing and not to use alcohol-based sanitizers while lighting lamps and diyas. Prime Minister takes the lead, invites former presidents and prime ministers to join the fight against coronavirus. More than 50 crore poor and vulnerable citizens will be eligible for free COVID-19 testing and treatment under Ayushman Bharat scheme. Government says spitting at public places should be avoided to contain the spread of the virus. ICMR informs there is no evidence of airborne transmission of COVID-19. And 28,000 relief camps and shelters have been set up across the country for the migrants and the poor. The nation is all set to join in Prime Minister Narendra Modi's call to switch off lights at 9 p.m. for 9 minutes and light up diyas, candles or mobile flashlights to display India's collective spirit to defeat coronavirus COVID-19. Earlier in the day, Prime Minister reminded people of the exercise, tweeting the hashtag 9 p.m. 9 minute. On Friday, in a video message, the Prime Minister said India will experience the power of light, clearly illuminating the common purpose the country is fighting for. He said, amidst the darkness spread by the corona pandemic, the country must continuously progress towards light and hope. Prime Minister added, no one is alone during this lockdown. He said the collective strength of 130 crore Indians is with each person.
रात 9 बजे घर की सभी लाइटें बंद करके घर के दरवाजे पर या बालकनी में खड़े रहकर 9 मिनट के लिए मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट जलाएं और उस समय यदि घर की सभी लाइटें बंद करेंगे, चारों तरफ जब हर व्यक्ति एक एक दिया जलाएगा, तब प्रकाश की उस महाशक्ति का एहसास होगा जिसमें एक ही मकसद से हम सब लड़ रहे हैं, ये उजागर होगा.
The Prime Minister also urged the people to maintain social distancing, stay indoors and not form groups while lighting lamps. He said one must never cross the Lakshman Rekha of social distancing.
इस आयोजन के समय किसी को भी कहीं पर भी इकट्ठा नहीं होना है. रास्तों में, गलियों में या मोहल्लों में नहीं जाना. अपने घर के दरवाजे, बालकनी से ही इसे करना है. सोशल डिस्टेंसिंग की लक्ष्मण रेखा को कभी भी लांघना नहीं है. सोशल डिस्टेंसिंग को किसी भी हालत में तोड़ना नहीं है. कोरोना की चेन तोड़ने का यही रामबाण इलाज है.
Prime Minister also said the way people express gratitude to those fighting against COVID-19 on the 22nd of last month has become a model that is being emulated by other countries. Citizens are advised not to use alcohol-based sanitizers while lighting diyas and candles at 9 p.m. as these are inflammable. Yoga Guru Swami Ramdev also came out in support of Prime Minister Narendra Modi's call to the nation to switch off lights at 9 p.m. today. He said that lighting diyas tonight will show the nation's gratitude towards frontline personnel fighting against COVID-19.
रात 9 बजे कोरोना योद्धाओं के सम्मान में दीप जलाकर उनके प्रति अपनी कृतज्ञता जताएं और 135 करोड़ भारतीयों के अभिभावक श्री नरेंद्र मोदी जी के कोरोना मुक्त भारत के अभियान को सब मिलकर के सफल बनाएं.
Puducherry Lieutenant Governor Dr. Kiran Bedi appealed to all the people of Puducherry to light a lamp at 9 p.m. tonight.
At 9 p.m. for 9 minutes, we will all individually, not collectively, individually stand at our doorstep or in the balcony and light a lamp.
Film actor Mohan Lal also urged people to light lamps and said that the gesture will be a beacon of hope and solidarity for the entire nation.
As the nation is in a silent war with the pandemic COVID-19, all of us are together in strength of mind to fight this unseen enemy. In these difficult times, amidst A nationwide lockdown, our Honorable Prime Minister has requested all of us to join in solidarity today, Sunday the 5th of April at 9 p.m. for 9 minutes in a spirit-lifting initiative to light a lamp in front of our homes. The light that we shine should be the beacon for hope and solidarity for all the Indians, and I implore each one of you tonight to light a lamp in front of your house.
West Bengal is all set to join with the rest of the country to respond to the Prime Minister Mr. Narendra Modi's clarion call for eliminations against dark days of COVID-19. Except emergency service preparations are on in full swing for rising to the occasion. Here is a report from our Kolkata correspondent.
The lights in the Raj Bhavan in Kolkata will be put off at exact 9 in the evening in response to the Prime Minister Narendra Modi's appeal to the nation for fighting against COVID-19. The State Governor Jagdeep Dhankar will take part in the event by lighting candles and diyas. Several programs have been chalked out throughout the state to mark the day where celebrities of different fields and common men will take part, maintaining the norms of social distancing. Arijit Chakraborty, EIR News, Kolkata.
In the wake of Prime Minister's call to switch off lights at 9 p.m. and light up lamps to show the country's collective resolve to fight coronavirus, the government has reiterated that common area places, hospitals and other essential services do not have to switch off their lights. No street lights will be switched off for these 9 minutes either. In a FAQ released by the Power Ministry on power grid operations during the light out, it was stated that all domestic appliances will be safe during the period and there is no need to switch off fans, air conditioners, fridges and others. The ministry asserted that the Indian electricity grid is well designed to handle such kind of load variation and has several inbuilt levels of control and safety mechanisms to absorb any kind of frequency changes occurring due to such load variation. The ministry rejected the apprehensions that this may cause instability in the grid and fluctuation in voltage which may harm the electrical appliances. The ministry also said no load shedding is planned.
As many as 505 fresh confirmed cases of COVID-19 have been reported in the country since yesterday. The total tally of confirmed COVID-19 cases is 3,577 till now. 275 patients have been discharged from hospitals after recovering from the virus, while 83 patients have lost their lives. Addressing media in New Delhi today, Joint Secretary in the Health Ministry Love Agarwal said the doubling rate of corona cases in India is 4.1 days. He said if Tablighi Jamaat incident had not happened, it would have taken 7.4 days. The Joint Secretary informed that 274 districts across the country are affected due to coronavirus so far.
अब तक देश में 274 जिलों में कोविड के केसेस आ चुके हैं और कैबिनेट सेक्रेटरी साहब ने स्पेसिफिकली सभी डीएम से ये रिक्वेस्ट की है कि कोविड के रिस्पांस में यूनिफॉर्मिटी बने रहना बहुत जरूरी है और इसके लिए देश के सभी जिलों में एक क्राइसिस मैनेजमेंट प्लान फॉर कोविड-19 बनाया जाए। इसके साथ ही माननीय प्रधानमंत्री जी ने देश भर में कोविड रिस्पांस की प्लानिंग, प्रिपेयर्डनेस और इम्प्लीमेंटेशन के लिए बनी हुई एम्पावर्ड ग्रुप्स की कल मीटिंग ली और उन्हें ग्रुप्स ने जो एक्शन उनके स्थाई पर आइसोलेशन और क्वारंटाइन फैसिलिटीज, टेस्टिंग और क्रिटिकल केयर ट्रेनिंग से संबंधित उसके बारे में अवगत कराया।
Mr. Agarwal added that states have been instructed that pharma units making devices and medicines must run seamlessly. The Joint Secretary also said that spitting at public places should be avoided to contain the spread of the virus.
आईसीएमआर ने एक और एडवाइजरी के द्वारा बताया है कि सार्वजनिक स्थानों पर थूकना कोविड वायरस के स्प्रेड को बढ़ा सकता है। कोविड वायरस की महामारी के बढ़ते हुए खतरे को मद्देनजर रखते हुए उन्होंने अपील की है कि कोविड महामारी के दौरान धूम्रपान, तंबाकू उत्पादन, गुटखा इत्यादि के सेवन और सार्वजनिक स्थानों पर थूकने से हम परहेज करें।
Interacting with the media, Joint Secretary in the Home Ministry, Punya Salila Srivastav, said the situation of essential goods and services is satisfactory in the country. She said around 28,000 relief camps and shelters have been set up across the country.
राज्यों में लगभग 28,000 रिलीफ कैंप्स और शेल्टर्स स्थापित किए गए हैं। उसमें 23,924 सरकार द्वारा सेटअप किए गए हैं और 3,737 एनजीओ द्वारा सेटअप किए गए हैं। इन शेल्टर्स में कुल 12.5 लाख लोगों को आश्रय मिला है। इसके अलावा 19,460 फूड कैंप्स भी सेटअप किए गए हैं जिनमें 9,951 सरकारों द्वारा लगाए गए हैं और 9,509 NGOs द्वारा लगाए गए हैं। लगभग 75 लाख से ज्यादा लोगों को भोजन उपलब्ध कराया जा रहा है।
Head scientist in Indian Council of Medical Research, Raman Gangakhedkar, clarified that there is no evidence of airborne transmission of COVID-19 as yet.
अगर एयरबॉर्न होता था इन्फेक्शन, ड्रॉपलेट इन्फेक्शन नहीं है, एयरबॉर्न इन्फेक्शन है, तो कोई भी फैमिली में जो भी कॉन्टैक्ट्स हैं सारे के सारे पॉजिटिव आना चाहिए। वो तो वही माहौल में रह रहे हैं जिस माहौल में वो जो पेशेंट है वो भी सांस ले रहा है और हवा छोड़ते ही जा रहा है। हमको एक समझना बहुत जरूरी है, उसको हम हमारी भाषा में बायोलॉजिकल प्लॉजिबिलिटी बोलते हैं कि एक अंदाज कि ये सही में दिखता है या नहीं दिखता है।
Union Health Minister Dr. Harshvardhan has said that more than 50 crore poor and vulnerable citizens will be eligible for free COVID-19 testing and treatment under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana (PMJAY). In a tweet, Dr. Harshvardhan said that testing at private labs and treatment in designated hospitals has now been made free for Ayushman beneficiaries across the country. He said the private sector should act as a key partner in the fight against COVID-19 infection. Dr. Harshvardhan appealed to the private labs and hospitals to come forward in large numbers to become a part of this effort. Health Minister Dr. Harshvardhan has said that All India Institute of Medical Sciences, Jhajjar, will function as a dedicated COVID-19 hospital consisting of 300-bed isolation wards. The minister today visited AIIMS Jhajjar and took stock of preparedness to overcome COVID-19. He appreciated the hospital for ensuring 24/7 monitoring and the well-being of COVID-19 confirmed and suspected patients using digital platforms and video call technologies. He also stated that the Home Ministry has taken cognizance of incidents of attacks on doctors and health professionals and advised the authorities to take stringent action against National Security Act. He said that the prevention, containment and management of COVID-19 in the country are being monitored at the highest level and various actions have been initiated in collaboration with the states.
In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Rakesh Garg, Professor of Anesthesiology, Critical Care, Pain and Palliative Medicine at AIIMS said, only through social distancing, novel coronavirus can be contained. Speaking to AIR News, Dr. Garg said, people need to stay home to stay safe and break the chain of transmission of COVID-19.
If the social isolation continues in a very nice way, then probably we'll be able to have containment. So there may be some clusters which are upcoming, but with good contact tracing and with good quarantine of those who have suspects or those who have contact with these positive patients, if they can do a good amount of quarantine at respective places, then probably we think that the containment of the virus may be a good option, and we hope that it would happen.
Dr. Naresh Gupta of LNJP Hospital said it is misconstrued that only elder people have risk of COVID-19. He underlined that people of all age groups should take precautions and follow the advice of social distancing and hygiene.
खांसने के समय ऐसा खांसना छींकना चाहिए कि दूसरे के ऊपर नहीं जाए। टिश्यू पेपर रखे, रुमाल रखे, कोहनी रखे, बचाव करे। जब वो खांसता छींकता है तो 1 से 2 मीटर तक वो जा सकती है। तो अगर आप पहले 1-2 मीटर का फासला बना के रखेंगे तो उसका आपके तक पहुंचने का अंदेशा बहुत कम हो जाता है। जो कॉन्टेक्ट ट्रांसमिशन की बात आई फॉर्माइट से, उसके लिए हम कहते हैं कि आप हाथ साफ करें। हाथ अगर आप धोते रहेंगे तो उसमें जो वायरस है वो साबुन पानी के द्वारा निकलता रहेगा, और उसके साथ साथ अगर जरूरत समझे या पानी नहीं हो तो आप सैनिटाइजर का इस्तेमाल भी कर सकते हैं।
The News Services Division of All India Radio in its bilingual live phone-in program will bring you today a special discussion program on COVID-19. Dr. V.K. Paul, member Niti Aayog and chairperson Empowered Group for Medical Emergency Management Plan to tackle COVID-19 will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. I repeat, 1800-115767. You can also ask questions on telephone number 011-2331-4444. I repeat, 011-2331-4444. and post queries on our Twitter handle @AIR News Alerts by the hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on Air app for updates.
Prime Minister Narendra Modi today called former Presidents Pranab Mukherjee and Pratibha Patil to discuss COVID-19 related issues. He also made calls to former Prime Ministers Dr. Manmohan Singh and Mr. H.D. Devegowda about the ongoing pandemic. The Prime Minister also called up leaders of various political parties, including Congress President Sonia Gandhi, Samajwadi Party leaders Mulayam Singh and Akhilesh Yadav, West Bengal Chief Minister and TMC Chief Mamata Banerjee, and Odisha Chief Minister and BJD President Naveen Patnaik. Besides, he also spoke to TRS Chief and Telangana Chief Minister K. Chandrasekhar Rao, DMK leader M.K. Stalin, and Akalida leader Prakash Singh Badal. Prime Minister Modi will also interact with floor leaders of various political parties in Parliament through video conferencing on Wednesday. MSME technology centers are contributing in a big way in the country's fight against COVID-19. 18 operational technology centers, autonomous bodies under Ministry of Micro, Small and Medium Enterprises are engaged in fighting the pandemic.
The Central Footwear Training Institute Chennai procured and installed hot sealing machine for job work of sealing masks and medical gowns. MSME Technology Center Hyderabad is developing a prototype of ventilator. It is electromechanical ventilator based on sensors. First prototype will be ready soon. Central Tool Room and Training Center Kolkata is developing a simple and low-cost ventilator system in consultation with Sagar Datta Super Speciality Hospital. MSME Technology Center Kannauj has started manufacturing alcohol-based sanitizers. Meanwhile, Institute of Design of Electrical Measuring Instruments is developing iron-based sanitizer. MSME Technology Center Hyderabad, Bhubaneswar and Jamshedpur will manufacture components for 650 corona testing kits. With Suparna Saikia, Anupam Mishra, AIR News, Delhi.
This is All India Radio, bringing you a special program on COVID-19. A reminder of the headlines before we move on. Prime Minister Narendra Modi gives a call to light diyas, candles at 9 tonight, symbolizing the nation's collective spirit to defeat COVID-19. Citizens reminded to maintain social distancing and not to use alcohol-based hand sanitizers while lighting lamps and diyas. Prime Minister takes the lead, invites former presidents and prime ministers to join the fight against coronavirus. More than 50 crore poor and vulnerable citizens will be eligible for free COVID-19 testing and treatment under Ayushman Bharat scheme. The government says spitting at public places should be avoided to contain the spread of the virus. ICMR informs there is no evidence of airborne transmission of COVID-19, and 28,000 relief camps and shelters have been set up across the country for migrants and the poor. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Railways is making all efforts to ensure that there is no shortage of sugar, salt and edible oil during the nationwide lockdown. Ministry of Railways said the loading, transportation and unloading of these essential commodities have been in progress in full swing. In the last 13 days, Railways loaded and carried 1,342 wagons of sugar, 958 wagons of salt and 378 wagons of edible oil. The ministry said freight movement is being closely monitored by senior officers. It added that the Home Ministry is also in touch with state governments to sort out operational issues.
Officers and staff of Ministry of Finance, financial institutions and public sector banks have contributed 430 crore rupees towards the Prime Minister's Citizen Assistance and Relief in Emergency Situations PM CARES Fund to combat COVID-19 outbreak. All came forward to donate a day's salary to the fund. This dedicated national fund was set up on the 28th of March with the primary objective of dealing with any kind of emergency or distress situation as posed by the COVID-19 pandemic and to provide relief to the affected people. EPFO has issued revised instructions to its field officers to facilitate PF members to rectify their date of birth in EPFO records. The step was taken to extend the availability and reach of online services in the wake of the COVID-19 pandemic. The PF subscribers can submit correction requests online. This will enable EPFO to validate the date of birth of members online with UIDAI instantly, thus authenticating and reducing the processing time of change requests.
Chief of Defence Staff General Bipin Rawat today visited a COVID-19 camp in Narela in New Delhi and interacted with civilian doctors and military medical team members. General Rawat expressed satisfaction over the excellent synergy between the civil and military medical teams and assured them of all assistance to jointly overcome this crisis. Union Minister of Development of Northeastern Region, donor Dr. Jitendra Singh today said that regular air cargo supplies, including essential commodities and medical equipment, are reaching northeastern states. Dr. Singh said there is no dearth of any item, nor there is any possibility of any shortage in the days to come. Dr. Singh said after lockdown, air cargo flights started operating to northeastern region as well as other distinct regions including the Union territories of Jammu and Kashmir and Ladakh and the island territories. Dr. Jitendra Singh assured that in future also, arrangements are in place to arrange for an air cargo flight at a short notice whenever a demand or requirement is raised. Dr. Jitendra Singh also informed that international border measuring about 5,500 kilometers along the northeast India stands fully sealed to contain the spread of coronavirus.
J&K Health and Medical Education H&ME Department has refuted a news item carried by a news group regarding dearth of medical equipment in Jammu and Kashmir to tackle the threat of coronavirus COVID-19 pandemic. The department further said that there is absolutely no shortage of logistics and equipment and sufficient buffer stock of PPE, masks and other protection gear is available both at Srinagar and Jammu. Drug and Food Control Organization J&K today airlifted substantial stocks of life-saving drugs, especially anti-cancer, anti-hypertensive and anti-diabetic drugs in the valley in the wake of lockdown due to coronavirus to ensure adequate supply of such medicines to the vendors located at Srinagar. The consignment weighing about 631 kgs would be sufficient to suffice for 2 months.
In Jammu and Kashmir, 40 new positive cases of novel coronavirus, all from Kashmir division, have been reported today, thus taking the total number of positive cases in Jammu and Kashmir to 106. Out of 106 positive cases, 100 are active positive, 4 have recovered and 2 have died. Till date, 33,503 travellers and persons in contact with suspected cases have been put under surveillance. 165 more persons who were shifted into administrative quarantine upon their return to Srinagar 2 weeks ago were discharged today after successfully completing their 14-day quarantine period. Around 1,900 persons who had been put under administrative quarantine in Srinagar. Most of these included those who had returned from abroad.
Ladakh MP Jamyang Sering Namgyal convened a video conference meeting with Chairman CEC, ECs and councillors of LAHDC, Kargil. He discussed various issues like requirement of essential commodities in far-flung areas of Ladakh. MP Ladakh extended his gratitude to the members of LAHDC Kargil for their contribution and assured them of equal representation of both the districts of Ladakh parliamentary constituency. The district administration Kargil has adopted a multi-pronged mechanism to the district. Even as restrictions under Section 144 CRPC are in place, house-to-house delivery of essential commodities is also being ensured without a break.
In order to curtail COVID-19 spread, Himachal Pradesh Police has issued a stern warning to district heads of Tablighi Jamaat to either disclose details of all those who attended the congregation at Nizamuddin in Delhi last month or action will be taken against them. Chief Minister Jairam Thakur directed the officers that aggressive campaign must be launched to find such persons. A report.
According to DGP Sitaram Maradi, FIR would be registered against Tablighi Jamaat members for the charge of attempt murder under Section 307 of IPC if they deliberately concealed the information that they had attended event Markaz at Nizamuddin, Delhi. Meanwhile, to deal with COVID-19 spread, the state government has imposed a complete ban on sale and distribution of chewing gum, bubble gum and other such products in the state for 3 months. Sanjeev Sundaryal, AIR News, Shimla.
In Uttarakhand, 4 more COVID-19 positive cases were reported today. As per the official report, total number of COVID-19 positive cases has reached 26 in the state. However, 144 samples were tested negative today, taking the total number of negative cases to 868. 89 sample results are awaited.
Chief Minister of Uttar Pradesh, Yogi Adityanath, today had meetings with religious heads and members of parliament, along with union ministers, and asked for their support in the fight against the pandemic. Gearing up the medical facilities in the state, the government has also established Level 1 hospitals in each and every district of the state. A report.
During meeting through video conferencing, Chief Minister Yogi Adityanath appealed to the religious leaders of the state to help in implementing the lockdown effectively and use their clout to persuade people to remain indoors. Meanwhile, DGP of the state, Hitesh Chandrawasthi, today said that police are also taking help of religious heads and influential persons of the society to implement the lockdown properly. Speaking exclusively to AIR, Mr. Awasthi said that there has been cases of attack on police persons and we will take strict action against them, and even National Security Act can be imposed on such persons. Sushil Chandra Tiwari, AIR News, Lucknow.
Jharkhand has registered its third corona-positive case from Bokaro today. The woman hails from Tilo Basti of Chandrapura and has a travel history to Bangladesh. Her husband and children have tested negative but have been quarantined in isolation wards at Bokaro Hospital. Maharashtra Health Minister Rajesh Tope today said 55 fresh cases of coronavirus have been reported in Maharashtra, taking the total count to 690 in the state. He said 56 people have been cured and discharged from the hospital, with 4 more persons, including a minor, testing positive for coronavirus in the areas under Kalyan, Dombivli Municipal Corporation today. The number of such patients in the region rose to 28.
In Madhya Pradesh, in view of the increasing number of corona-infected patients in the state, and especially in Bhopal, the complete lockdown is being implemented from tonight in the capital Bhopal. Complete lockdown is already implemented in Indore. A report.
In Madhya Pradesh, good news has come from Jabalpur, as out of total 8 corona patients, 3 were discharged from the hospital today. Out of these patients, Mukesh Agrawal was state's first corona-infected person. He and his wife thank the doctors and the administration for their support.
बस हिम्मत नहीं हारना चाहिए। कोरोना बिल्कुल मामूली सी बीमारी है, डॉक्टर का सपोर्ट करिएगा, बहुत जल्द ठीक होकर अपने घर वापस जा सकते हैं।
Meanwhile, Chief Minister Shivraj Singh Chauhan today discussed with the Director of AIIMS Bhopal, the Head of the Department of Medicine and the State Technical Advisor of COVID-19 about the condition of coronavirus and medical arrangement in the state. Sanjeev Sharma, AIR News, Bhopal.
The number of corona-positive cases has gone up to 253 in Rajasthan. Highest 47 new cases reported in a single day today in the state. 39 cases have been reported from Jaipur, 2 cases reported from Tonk, and 1 each case has been reported from Tonk, Jhunjhunu and Nagaur districts. 3 evacuees from Iran also tested positive. In Tamil Nadu, 86 more people were tested positive for COVID-19 while 2 people died of the disease today. Barring 1 case who has a travel history to Dubai, all the other new cases are those who attended the Delhi Jamaat congregation. With this, the total number of infected people in the state has risen to 571.
And now, before we end, the headlines once again. Prime Minister Narendra Modi gives call to light diyas, candles, symbolizing nation's collective spirit to defeat COVID-19 in a short while from now. Citizens reminded to maintain social distancing and not to use alcohol-based hand sanitizers while lighting lamps and diyas. Prime Minister takes the lead, invites former presidents and prime ministers to join the fight against coronavirus. More than 50 crore poor and vulnerable citizens will be eligible for free COVID-19 testing and treatment under Ayushman Bharat scheme. Government says spitting at public places should be avoided to contain the spread of the virus. ICMR informs there is no evidence of airborne transmission of COVID-19. And 28,000 relief camps and shelters have been set up across the country for migrants and the poor.
As we end this special news program on COVID-19, the nation is enthusiastically preparing to answer Prime Minister Narendra Modi's call to light candles and diyas in a short while from now. People from across the country are ready to come together in this collective gesture of India's commitment to fight COVID-19 and a reminder that no one is alone in this war against the pandemic.